Good afternoon and welcome to our daily media briefing. Today you're going to be hearing from Supervisor Nathan Fletcher. He'll be followed by Dr. Eric McDonald, and then Dr. Efantides will be wrapping it up as far as the presentations. These are certainly challenging times for all of us, and especially for those who are low income or out of a job as a result of COVID-19 and in need of either food or health care assistance. That's why it's important to remember that although the county family resource centers are closed for in-person transactions, our dedicated county staff are still on the job assisting residents in need of CalFresh, Medi-Cal, and General Relief, along with CalWorks and all of those benefits. Last week, our Access Customer Service Center fielded more than 10,000 calls a day from residents with questions about their benefits. Through our county contractors, thousands of meals are being delivered to seniors every day. So please know that critical county services and programs and community-based services remain open and available to support those in need, even in these times of social distancing. For information about our county programs, the best place to start is the County of San Diego website at sandiegocounty.gov. Enrollment information is also available there. In addition, you can also call 211 San Diego, which is a vital resource for information not only about county programs, but also about those operated by community organizations as well. And with that, I'll call up Supervisor Fletcher.
Thank you and good afternoon. Let's jump right into the new numbers we have. We'll pull up the first chart here. And before we go into the numbers here, I just want to caution everyone that the numbers, again, on a day-to-day basis do not tell us anything significant other than we have continued spread. You'll see in today's number, the number is down a little bit from the previous few days. That in large part probably reflects a lag or delay in testing. You'll recall a few days ago we talked about the limitations on reporting and testing. And so even though the number is down a little bit, we still believe that this is a growing situation and we need the public's continued commitment, not necessarily to make decisions or assumptions about what's happening day to day, but to recognize where we are in this process relative to many other jurisdictions that are struggling. It is still early. We still have wide community spread, and the adherence to the social, physical distancing efforts and hygiene things are most critically important now. But we are reporting 31 new cases for a total of 519. Second slide goes to testing. And again, we're reporting 1,275 tests from yesterday. These are tests reported to us. Some of this is impacted by the delay of a few of the systems we talked about over the past few days. And so we hope to both get the reporting back online while we also have additional testing coming online, and we will keep you posted of both of those each and every day. Moving into a couple other quick updates, our efforts surrounding tackling the issues surrounding homelessness continue. We are in ongoing discussions with the mayor of San Diego, along with the Regional Task Force on Homeless, surrounding an integrated regional effort and approach. And we hope to have a more specific update on the efforts and actions that are coming in the few days, hopefully as early as tomorrow. Our motel room count currently stands at 2,026. 1,585 of those are public health rooms. Out of those rooms, 112 are currently occupied, with 109 of those coming from our unsheltered and homeless population. The entry point into those public health rooms both coming from our public health nurses who are embedded in our shelters, along with referrals from the public health nurses who are with our homeless outreach teams. We've also allocated 441 rooms, motel rooms, to the Regional Task Force on Homeless to fill consistent with their protocols. Of these, 170 of those rooms are currently filled. We are working with the state of California today. The governor made a series of announcements and executive orders, primarily surrounding healthcare workforce and staffing. We are in daily communication with the state around the integration between what we're doing and what the state of California is doing. And tomorrow we'll provide a little bit more updated information surrounding our efforts to both raise the bar of hospital room capacity along with raising the bar of available rooms within our healthcare system, and how all of that is consistent with what's happening at the state of California, and in many ways how our efforts here locally are benefiting from the actions of the state of California. Today we are issuing 2 new public health orders related to cruise ships. San Diegans are certainly willing to be good partners and neighbors and do our part to provide humanitarian assistance, and we have certainly done that. As a region, we received the repatriated flights of individuals from China into Miramar. We received the repatriated flights of cruise ship from the Princess Cruise Line, who docked up north but then flew to Miramar. And we have received now, I believe, 5 different cruise ships that have arrived in our ports. And we're issuing 2 public health orders, one to limit the arrival of future cruise ships, and the second one is to provide better controls and parameters to ensure the orderly disembarkation of staff and crew of those cruise ships that are already here. And here to brief us on both of the public health orders along with cruise ships is Dr. Eric McDonald.
Thank you, Supervisor. As the Supervisor mentioned, we have issued 2 health orders today. The first is on cruise ship disembarkation, and I'll just read the first 2 bullets on the orders. No passenger or employee may disembark a cruise ship in San Diego Harbor without the approval of the health officer or designee if any person on the cruise ship has tested positive for COVID-19. Any cruise ship that is permitted to dock in San Diego Harbor shall notify the health officer or designee regarding any emergency medical treatment required for a passenger employee and follow all directives of the health officer or designee. I would like to say that this order is being placed so that it provides a legal framework for us to continue the very constructive and cooperative planning that we've had with all of the stakeholders at the port, the CDC quarantine station, the CDC cruise ship task force, the port, the city, CBP, and the cruise ship companies themselves. We have successfully been able to plan and affect the disembarkation of all the passengers, and really this is meant to make sure that that constructive process continues with crew. I would like to add that the disembarkation plan that is currently underway with the Celebrity Eclipse has our approval and support. It is being conducted using CDC guidelines, and most of the passengers should be leaving the ship today, with a few remaining tomorrow. It's important to point out that there are no known positive COVID patients on that ship or crew. The second order has to do with cruise ship docking. It states that no cruise ship in San Diego Harbor may dock or disembark employees or passengers after March 31st, 2020. However, upon approval of the health officer, a cruise ship may dock solely for the purposes of receiving fuel and provisions, so long as no employee or passenger disembarks. Cruise ships docked in San Diego Harbor shall notify the health officer or designee regarding any emergency medical treatment for a passenger employee and shall follow all directives of the health officer or designee. And this, again, is intended to deal with any future states. I know there have been questions about ships that have come before, and I can say that the individuals who have all departed these ships in the past to date and through tomorrow have all been screened, have no symptoms, and have no fever, and are leaving to go to their eventual homes of record to complete 14 days of CDC recommended quarantine. The best place for those individuals to complete quarantine is at home. And actually there are 17 San Diegans on the Celebrity Eclipse that will be completing their quarantine in San Diego. The only ship that has known positive COVID cases is the Disney Wonder. There was 1 passenger that is known to be positive that is currently hospitalized, and there is 1 crew member that is known to be positive that is currently hospitalized. There are 2 pending cases, and there was 1 emergency evacuation from the ship overnight. I think those are my details, and I'll answer questions as they come up.
Thank you so much, Dr. McDonald. Deeply appreciate all that you do, especially with some of these unprecedented challenges. As is our routine, I would like to now go over the numerical summary of where we are at, starting with the global. Globally, the novel coronavirus, which is causing COVID-19, has resulted in over 766,000 positive cases and nearly 37,000 deaths. Nationwide, there are over 153,000 positive cases with nearly now 3,000 deaths. Statewide here in California, there are over 6,300 positive cases and 132 confirmed cases that have passed away from complications. And as was just mentioned by Supervisor Fletcher, here in San Diego County, we have 519 positive cases, and that is a delta of 31 cases of an increase since yesterday, including 7 confirmed deaths. Of the 519 cases, 63% are between the ages of 20 to 49. 42% are female, and 57% are male. 20% of these cases have been hospitalized. 9% have been admitted into intensive care, and unfortunately, just over 1% of the cases have passed away from their complications. In terms of the issue of concern with regard to what is happening in congregate care settings, we really don't have anything officially new to report in terms of the number of congregate care settings where confirmed outbreaks have occurred. I will say that at the 4 confirmed sites, we now have 33 positive cases and 2 confirmed deaths. Monitoring and investigations are actively ongoing. Lastly, our hospital capacity, something that we are all paying close attention to and working our hearts out trying to maintain and protect. The data continues to show optimal proactive hospital capacity. I do want to say that there is a little bit of a flip side concern with regard to this. There are still very appropriate reasons for individuals to seek emergent care. For example, cardiovascular issues, stroke issues that are very time sensitive. We do not want individuals having hesitation who need care for those reasons being reluctant to seek it. Lastly, I've been asked for the opportunity to say a special thank you. Today is a very special day for many of my colleagues, and that is that today is National Doctors Day. You know, I've been seeing a lot of public service announcements by celebrities. In my heart, the only celebrities that really matter today at a national level are our medical celebrities. Dr. Anthony Fauci, Dr. Francis Collins from the NIH, a man I have met and a brother in faith, Dr. Jerome Adams, our Surgeon General, and here in San Diego, our Public Health Officer, Dr. Wilma Wooten, my colleague, Dr. Eric McDonald, our EMS Medical Director, Dr. Christy Koenig, my Associate Chief Medical Officer, Dr. Jen Tudor, and there are many, many more. Folks, I as a doctor know we as physicians are just part of the team, so I would be remiss, of course, if I didn't call out our nurses, our paramedics, our firefighters, our lab technicians, our researchers, all of our healthcare workers. You're the celebrities, and today is your day, and we just want to wish, especially my fellow physicians here in San Diego, happy Doctors' Day. We appreciate you so much. You bless us beyond belief with your efforts. Thank you very, very much.
Thank you, Dr. Nick, and thank you to all of our doctors on National Doctors Day. We're going to get right to the calls. We have 3 that have called in. Again, as per the usual procedure, we ask you if your name and outlet is not identified in the introduction, please do so. Let's go right to the first question.
KPBS, please state your name and question.
Hi, my name is Matt Hoffman calling from KPBS. Based on what the governor said today, needing more medical workers in preparation for a surge in cases, when you're talking to hospitals, when you're evaluating your own staff at the county, is there a need here for more workers in general? And are hospitals here being overwhelmed? Are you guys being overwhelmed, the county medical staff?
We'll get Dr. Ifantidis to answer that.
Thank you for that question. I want to put that in context and remind you of something that we are constantly looking at. With regard to capacity, we here at the county follow the 3S context: staff, stuff, and structure. Currently, we are good in terms of where we at, but obviously, still being in the calm before the storm, we are looking down line. As Supervisor Fletcher has mentioned multiple times, we are collaboratively part of the statewide recruitment effort and registry. I am also aware that our local medical society is developing one as well. In the coming days, our capacity to be able to more appropriately and specifically prepare for that workforce, that staff component, is something that is very much on our radar screen. In terms of where we are today, we feel strongly that we are optimally positioned and prepared.
And then a follow-up on that, I know that the governor says that the coming weeks will be crucial. You guys have said similar things. Why are the coming weeks crucial? What are we looking for in the next coming weeks here? What are we trying to prevent?
I mean, the coming weeks are crucial because, as we have said repeatedly, we did not use those words again in respect to the fact that you have heard these messages before. We are still ahead, I believe, meaningfully ahead of the apex that is coming. And as the volume of individuals needing care may occur with regard to COVID-19, we have to be proactively prepared to have the staff, the stuff, and the structures to respond accordingly. We will not in San Diego wait until that challenge is upon us. We are proactively preparing for that now.
Okay, let's go to the next question.
Union Tribune, please state your name and question.
Paul Sisson with the ETB. Regarding the Disney Wonder cases that you just mentioned, how many additional exposures have these individuals popped up in your contact tracing in the community? How many additional people in the community have you found that they have exposed?
Okay, I think Dr. McDonald will answer that question.
It was a little unclear hearing. I think you were asking about possible contacts of the individuals who were positive cases from the Disney Wonder. Is that correct?
Yes, that's correct.
Yes. We do know that the crew member had been isolated on the Disney Wonder with the initial onset of symptoms, and that their close contacts were identified on the ship and self-quarantined, and I believe that there were less than 6 of those. And on the passenger actually went home to the prescribed self-quarantine immediately and only exposed family members, which is less than 5.
To follow up, was that person returning home in our community or another community?
That individual is a San Diegan, and we're unaware of any other cases outside the San Diego area at this time.
Thank you.
Okay, we'll go to the next question. This is the last call-in question that we have. We'll go to the text questions. If there are additional call-in questions, you can go ahead and do that. We'll pick those up after we hear the text questions.
NBC7, please state your name
Hi,
and...
this is Claudia Stefanian with NBC7. I know that leaders have been talking about how we've been able to kind of ward off this exponential surge. obviously leaving Friday, and Saturday, we hit big numbers, and I know you said that probably the numbers that we saw from yesterday are also misleading. Are these numbers a surprise to you, or do we seem to really be edging more towards that exponential surge?
Dr. Nick will answer that question.
None of these numbers in any way are a surprise to us. This is what we expect. The pace at which this will continue and the rate of what we technically call the exponential growth is yet to be finalized and determined, but what is clear to us is, sorry to keep using the same analogy, we are still very much in the calm before the storm. We expect, with all that we are doing and all that is observed and happening in other parts of our own country and certainly in other parts of the world, that we are probably nowhere near the peak and the apex, which we are doing everything we can to flatten, and on the flip side, everything we can to enhance our capacity with staff, stuff, and structures to respond accordingly. Thank you.
Okay, we're going to go to the texted in questions. The first two questions are really ones dealing with stuff. And so we're going to call in Jack Pellegrino, the director of our purchasing and contracting, to answer those questions.
All right, we'll start with a question from Lisa Halverstadt. Can you provide more information on the procedure once an individual is placed in a public health motel room? Are they ordered to remain inside, and for how long? I think this might be a question for someone else. How many of these individuals monitored and are served by the county and or contractors? These questions are changing from Lisa.
Okay. Dr. Nick, if you would.
Okay, so let's start again.
Yes, start again, please.
Can you provide more information on the procedure once an individual is placed in a public health motel room? Are they ordered to remain inside, and for how long?
The motel rooms to these individuals are given with intentionality. There is the expectation that they are to be quarantined. If any of them are positive and have been confirmed but have mild symptoms, they are to remain in isolation. There is a case-by-case nature of that, depending on the circumstances. Yes, besides just being a place to stay, they are receiving the other support services that they need to safely be in quarantine or in isolation for the appropriate period of time. Thank you.
Okay, she actually has a follow-up. Have any homeless San Diegans tested positive for COVID-19, and if so, how many, and where were those individuals previously living?
So out of the 109 unsheltered individuals who are in our public health motel rooms, none of those individuals to date have tested positive. They are individuals who are symptomatic, and many of them are awaiting the results of their test, but none of them have tested positive. They've entered into our system via a combination of public health nurses with homeless outreach teams who have observed homeless individuals with symptoms, referred them to the public health rooms for further evaluation, and via our shelters. And was just mentioned, individuals are in this room in quarantine. If they do test positive, then they will go to isolation, which is under a public health order requiring them to stay there for a 14-day period of time. But we have not had that occur yet. But we will keep you updated as we continue to track their status along with test results. Thanks.
And Supervisor Fletcher, if you could reiterate the numbers again for Cody Delaney at iNewsSource. Can you go back over the number of motel rooms the county has secured?
Yeah.
How many are there and how many are occupied, please?
So we have a total of 2,026 rooms total. They are split between 1,585 public health rooms. These are for positive tests, for persons under investigation, or in unique circumstances, individuals with symptoms awaiting further evaluation. Out of those 1,585, 112 of them are presently occupied total. The Regional Task Force on Homeless has been allocated 441 rooms. They will fill those with homeless individuals who have no symptoms but are particularly vulnerable based on age or underlying health condition. Of those, 170 rooms have been occupied, and we will continue to provide regular updates. Now, it is important to note on the public health rooms, we always anticipated that a significant number of those would be vacant. And the reason is, at some point in San Diego County, and this goes to a point that was just made a minute ago that I want to really reiterate, the day-to-day totals of positive cases do not mean very much. It is the broader trends that you see over time, and we simply don't have enough time to really understand those trends, nor do we have the full testing capacity we would like to have an accurate picture of positive cases. Every other jurisdiction that has encountered community spread like we have has seen a significant uptick in their number of cases, and they have seen that uptick many days further from their first reported case than we presently are. And so our operating assumption and belief is that we will have a significant increase in the number of positive cases in the coming weeks. In anticipation of that, we have secured these rooms to make sure that they are available. If our region sees a significant uptick in the number of positive cases, we could have a much greater need for these public health rooms in particular, which is why we have a significant number of them and why a significant number of them remain empty. At whatever point we hit that uptick, we will be incredibly grateful and glad that we thought ahead and had these rooms ready, along with not just the room, with the food service, laundry, janitorial, security, and everything that goes with them.
And Supervisor Fletcher, Cody asks again, how many requests have been made to place someone into a room?
Well, the number of people in the room. So the requests that have been made to put people in a public health room have been put in a public health room. As for the RTFH rooms, you would have to ask them how they're filling those rooms.
Thank you.
The next question deals with the Disney cruise ship, and we'll call up Dr. McDonald to respond to that question.
Yes, this is from Rachel Bianco from Channel 10. Does anyone know how many days passed from when the two people got off of the Disney cruise ship to when they started showing symptoms? If people can be infected without showing symptoms, how can you say passengers or crew getting off any ship are in the clear?
Well, there is one passenger who left the ship and was admitted to the hospital about 48 hours after leaving the ship. The crew member who was evacuated from the ship developed symptoms on the ship and was isolated for several days before being evacuated from the ship. So that when that person left the ship was known to be a potential COVID patient and was in fact handled that way. I think the second part of the question has to do with how do we know it's, I'm sorry if you could read that back for me. Sorry. The second part of that question?
Yes, my apologies. From Rachel. And if people can be infected without showing symptoms, how can you say passengers or crew getting off the ship are in the clear?
Well, I wouldn't use the phrase in the clear. What I would use the phrase is when somebody leaves the ship and has no symptoms, their likelihood of being infective to others rather than being infected is exceedingly small with the exception of their intimate contacts. That's the current understanding of the transmissibility of this virus. And so for those individuals to be asymptomatic and then transmitting or transporting themselves to their homes is really no more of a risk to the general public than the fact that there is community transmission and there may be individuals in the public who have asymptomatic incubating COVID-19, which is why we need to go back to the original advice that's being given to everyone, which is stay home, socially distance from individuals, only go out for essential activities. And these individuals who are leaving the cruise ship asymptomatic are doing an essential activity. They are actually going to their home so they can then complete 14 days of quarantine.
And also, how many passengers and crews have tested positive so far from that ship?
Well, I think I answered that question before. There was one passenger and one crew member, and there are, I believe, 2 tests that are pending at this time.
And I also have a question from Mario Escovedo from News 8. A local nurse treating COVID-19 patients became ill on March 20th and was tested March 23rd at Scripps. She still has not received results. Is the system prioritizing our frontline medical staff? Is this a typical waiting period more than 7 days?
Well, we're absolutely prioritizing our healthcare workers. It is extremely important that any ill healthcare worker be evaluated quickly so that they know whether they have this virus. If you listen to the dates carefully, those were about 10 days ago when initially when our capacity in the county was much lower than it is today. It's been increasing every day, and our systems are getting better at identifying healthcare workers specifically so that they can be tracked for a rapid turnaround time test. Some of that occurs at the county, some of that occurs at a hospital that's different than where the individual presents. Scripps now has their own internal capacities, and it's perhaps at the time they were having to rely on commercial labs to be able to get that turnaround time. So we hope that all patients in San Diego have a rapid turnaround time, but in terms of getting tested and getting a result. But the priority goes to healthcare workers, especially to individuals in skilled nursing facilities and other congregate living facilities where it's important to take public health action, for hospitalized patients so that we know whether we need to be using personal protective equipment as a precaution to care for those patients. And those priorities have been delineated in our health alerts going out to our local physicians.
And also, Dr. McDonald, this is from David from Channel 8. Can you please give us any numbers or percentages on false positive and or false negative results countywide?
The question about false positives, that meaning a test is positive when it really shouldn't be, or a false negative, meaning it's negative when it really should be positive, really is a difficult question to answer globally, but I will say that it is exceedingly unlikely to have a false positive just based on the nature of the test that's involved. It's a PCR test that looks specifically at a specific kind of RNA from this specific virus. So a false positive is really essentially next to zero. A false negative, however, is actually possible and is very dependent on how the sample is collected. So if it's not collected properly, then it may result in a negative test. Also, if you sample somebody who doesn't have symptoms, that may also be falsely negative for what might happen in the future, which is why we do not test individuals who are asymptomatic.
And he was also asking if you were going to update the modeling numbers.
I personally don't have an update today on the modeling numbers. I'll have to defer that to my colleagues.
This might also be for you, Dr. McDonald.
Sure.
This is from Carlo Cicchetto from News 8. Will the county release the names of the restaurants where the 4 employees tested positive?
As a rule, when we release the name of a location to the public for public health action, it's because it's specifically for the public to do something. We did that in hepatitis A. We specifically named a restaurant so that individuals who patronized that restaurant could get shots to prevent illness. But in the case of COVID-19, because of the widespread community transmission, the advice to the public in a specific named restaurant would be no different than what we're giving already to the general public, which is to stay at home, to socially distance, if you develop symptoms, to self-isolate, and if you develop symptoms severe enough to require treatment, that you actually be seen for treatment with your healthcare providers. That advice is the same, and it's not different whether there is a specific location that's involved versus not. Now, if on our investigations we felt differently, that there was a higher than stated risk than to very close contacts, then we would make such an announcement.
All right, thank you.
This next texted question has to do with portable toilets, and we'll ask Supervisor Fletcher to respond to that.
Yes, this is from Gary Worth from the Union Tribune. Any update on the installation of portable toilets?
Yeah, to date, we've received 10 requests for portable toilets. 4 of those have been placed. 6 are scheduled to be placed on the 30th. And we are letting jurisdictions know that if they have requests, they can submit them similar to how they did hand washing stations, and we will do our best to fulfill their requests for those as well.
Thank you. My next question is regarding schools. Today is the 2-week anniversary of schools across San Diego County closing, 2 weeks into the most significant social distancing campaign in recent memory. And where are we? Does the Public Health Department have any way of measuring whether social distancing is working?
Dr. Nick will answer that question.
That's from Paul Sisson from the UT.
As a father, I could have written that question myself. Look, transparently, as we keep saying, and over the weekend, a decision was announced. The orders that we now have in place with regard to all of the non-pharmaceutical interventions and social distancing efforts that we are doing on a regional basis have been extended indefinitely. The reason for that is, as I have said before, we are convinced that we are still in the period of the calm before the storm. For a host of reasons related to modeling, the testing capacity, the locally rapidly evolving rate of transmission, the dynamic nature of our current ability to specifically quantify our healthcare system capacity, because our health systems are being so collaborative and so proactive. Yes, we continue to work on those modeling projections under the leadership of Dr. Josh Smith, one of my epidemiologists, but the final and definitive dates that I know everybody is eager for, unfortunately, are just not available. I will also say that tomorrow is somewhat of a significant milestone in that it represents the 2-week period where the regional NPI orders and guidance were put into place. All of those factors have to be taken into consideration, and refining that analysis and process is something that we do on a daily basis. More to come on that.
The next question deals with motel rooms, and Supervisor Fletcher will answer that question.
Thank you. Yes, this is another follow-up question from Lisa Halverstadt of the Voice of San Diego. Supervisor Fletcher said that if individuals in motel rooms now in quarantine end up testing positive for COVID-19, they will be placed in isolation. Does this mean the person would necessarily move to another facility, or that different procedures will be followed?
Well, not presently. Presently, we haven't had any of these individuals test positive yet. And so we treat everyone in the public health rooms with the same level of care as we would of anyone who is positive. If they are positive, which hasn't happened yet, but at some point they will, person under investigation or person with symptoms are all treated the same. The only difference is if you have a positive test, then you move from a quarantine status to an isolation status. And at some point, as the numbers grow, we may change our procedures. But right now, all of our public health rooms are equipped to support the individual and treat the individual in a manner consistent with if they were a positive test.
Okay, I believe that completes our call-in questions and our text questions for today. Just a couple of parting comments. You may be watching at home and wondering how you can help. There's a lot of people that want to volunteer their time and their service. The county has put together a list of volunteer opportunities that are currently available to help with the COVID-19 response. These opportunities are available at the website justserve.org/SDcounty. If you are with an organization that has a need for volunteers, please visit that page and reach out to us using the contact information posted there. We will work with you to get your volunteer needs posted to the page so that volunteers can contact you directly with their offers to help. Thank you. We keep emphasizing the importance of social distancing. I saw a comment online the other day that went as follows: the virus doesn't move, people move it. We stop moving, the virus stops moving, the virus dies. It's that simple. Thank you, and remember, live well, stay well, and to stay well, stay home. All right, we have 2 more questions that came in. We'll go ahead and pick those up, and then we'll conclude today's media briefing.
KPBS, please state your name and question.
It's Matt Hoffman from KPBS again. I have 2 questions. The first one, the World Health Organization's Director General today said that government should be transparent with the residents and be upfront with them about how long restrictions to slow the virus's spread will be in place. What can you tell San Diegans about how long these public health orders will be in place? That's the first question.
Okay, Dr. Nick will answer that.
I know we hear indefinitely, but
Yeah, and Matt, thank you very much. And look, there are parts of the world, when the World Health Organization speaks, it is obviously speaking at a global perspective. Feel very strongly that that in concept may be possible and more practical in other parts of the world, but we are early enough, we are still in that waiting, almost staging, pre-surging phase, and there is nothing but transparency happening here. We just don't have the ability to provide any kind of more specific target dates or projections beyond those that we are continuously doing. I totally get where the WHO director is coming from. The applicability of that is probably more appropriate in other parts of the world where they are further along in the progress of their epi curve versus us, frankly, being on the front end. And we are doing everything we can to both shorten that time period and lessen the severity of what we will be facing.
And then the second question has to do with grocery stores. Obviously, we saw one person in Escondido test positive at that Albertson. Could we be seeing more restrictions come down on grocery stores in terms of, like, whether it's plexiglass, limiting the number of people? Are you guys working with grocery stores?
There are discussions that I'm looking at my trusted colleague, Dr. McDonald, on this issue. There are always discussions that are ongoing and considerations that are happening. Not that I am aware of in terms of any specific issues that we are currently formulating. And as Dr. McDonald just referenced with regard to the restaurant issue, in terms of follow-up, and I live in Escondido, I can totally relate to the concern. But in terms of us doing something, there has to be something actionable above and beyond that which we have already recommended. So I suspect that as we learn more about this situation, there may be some deliberations that are specific to grocery outlets at a broader global national context, but very honestly at a local level, that has not been specifically discussed. Thank you, Matt.
Dr. Nick, I might have one more for you. For Sarah Cohen from 10 News, following up on the question about restaurants. Since those workers are legally allowed to operate for takeout services under the county's guidelines, should the public have the right to know which restaurants may have workers who have tested positive?
The individuals, look, the guidance that are being given and the CDC guidance and the local guidance, and this is important, and it has been communicated over and over again, folks who work in those environments that have any symptoms whatsoever should immediately remove themselves from that setting. Absolutely clear about that. There is also absolute clarity that Dr. Wooten has repeatedly gone over in terms of the expectations that those facilities maintain social distancing and all of those precautions. Now, are there parts of the world and are there parts of the country where perhaps even more stringent guidance has occurred? Absolutely. In terms of those deliberations, day by day, they are ongoing. But again, to repeat what Dr. McDonald said, as far as the naming of the restaurants and so forth, it is only appropriate and relevant if there is actionable data upon which we are looking for members of the public or individuals to follow up on. Thank you very much.
That completes all of our call-in and texted questions. So that concludes today's media briefing. We'll be here tomorrow at 2:30. Thank you.